For the first time in months, the daily coronavirus infection rate in New York City has spiked above 3%. Increased outreach, testing, and enforcement in affected neighborhoods over the weekend has failed to slow the spikes. 8 zip codes in Brooklyn and Queens appear behind the increase, and there's concern that if the infection rates are not brought under control, schools might have to close again. New York Governor Andrew Cuomo says he intends to meet with community leaders to discuss those clusters. For more on this, let's bring in Dr. Neeta Ogden. She's an internal medicine specialist and immunologist. So, doctor, help us understand what we're seeing in New York City. What is the risk of these currently localized outbreaks getting larger, just as we saw back in March?
Well, I think this is a real cause for concern, especially as schools reopen. It's unfortunate that it's happening at the same time that we're seeing this uptick in cases, as you said, in 8 zip codes, some of which have a predominance of Orthodox Jewish communities. And what we know is that within some of these communities, there has been an absence of mask wearing because community members believe that they've, or at least heard that they have herd immunity based on how severely they were affected by the coronavirus in March. Well, that we know is just not the case. It's estimated that that kind of herd immunity is around 20%. And herd immunity that we need to achieve sort of immunity to coronavirus is more like 60%. So it's really up to administrators and the government now to, and they're saying that they're going to do this. De Blasio, the test and trace authorities, really work with leaders in the community who can get through to people about wearing masks, social distancing, because the reality is that it only takes one person traveling from, one of these communities on, public transportation or being anywhere. And then you have students who are around that person that can lead to a wider spread infection. So it's going to be very important that we keep an eye on this number.
So this is sort of interesting because, we talk about the pandemic in terms of the impact of COVID, but there's kind of a ripple effect as well. The Washington Post analyzed CDC data and found that over 13,000 excess deaths due to Alzheimer's and other forms of dementia in the U.S. since March. What role could the pandemic and the isolation that now many elderly people find themselves in, what role could that play in those numbers?
Yeah, I saw that data and I find it so sad because it's exactly that isolation that we're using as a strategy to contain coronavirus and keep those people safe that's actually leading to worse outcomes, this pandemic isolation. These types of illnesses like Alzheimer's and dementia, even being part of the geriatric population, we know that they do better with stimulation, with contact with loved ones, with conversation. And when they're cut off from that, they actually decline precipitously. And so we've even seen in this population of people increased falls, increased frailty, more respiratory infections, just because they just aren't doing as well. And these are people who were stable before and doing relatively well. So it's incredibly sad. There are a lot of things that are going to come out of this pandemic where the system and what we had in place failed a lot of people, and the outcomes were so much worse for them. And I think this is one population we really need to be thinking about. We can't just ignore them just because they're older.
According to a new report by a national nurses union, Dr. 1,700 U.S. healthcare workers have died from COVID-19. The report blames the government and employers for that high number. So explain to our viewers, what are some of the failings in protecting healthcare workers, and is that still a problem?
Yeah, well, the key word here is PPE. We know that in March, despite what some leaders and health commissioner, even in New York, said that there was adequate PPE. No, this was simply not the case. Being a doctor, I know when you use PPE, it's one and done. You see a patient and you throw it away. People were not sharing masks, but using a mask for days on end. And I've even heard, hospitals saying that every healthcare worker will be given one mask. I mean, that's not enough. We need more reassurances that healthcare workers will be protected if there is a second surge or as long as coronavirus is around. We know that Governor Cuomo is mandating that hospitals have a 90-day stockpile, but is that enough? We really need to see, once there's a higher utilization rate, is there enough PPE for healthcare workers? Because this is really, really urgent. Once we don't have the capacity for them to be protected, there just is so much weakness in the system. So that's, and frankly, I just have not heard enough about where is the PPE? Is there enough of an adequate supply? Will essential and healthcare workers be protected in that way? And I think that's what, this study that looked at 1,700 health, it's made me very sad to see this. This is kind of, could have been unnecessary if they had greater protection.
Doctor, as we know, sports leagues have been trying to move forward and still keep their players safe. Often there are no fans allowed in the stands. But now we see the Tennessee Titans have closed their facilities until Saturday, so they may not be able to play on Sunday against the Pittsburgh Steelers. We'll see what happens. But I'm wondering if you see this in a way as sort of a minor victory, because at least they were, at this point, it seems like they were able to contain the virus. And perhaps this is a way of moving forward, considering the fact that, we're probably going to be living with this virus for a while.
No, I think that's a really good point as sort of a new normal. And I mean, hopefully something like what we were talking about in New York can be the same, putting out little fires by acting quickly. Tennessee and Minnesota, I mean, they've had relatively high positivity rates. So I'm not surprised. I am glad that they acted quickly. We just have to be aware of that this is going to happen. And if we have the steps in place, we can emerge from these small fires and these small outbreaks successfully. But again, they have had high positivity rates. There's greater community transmission. So the likelihood of that happening is not surprising. It's not like the NBA where they were isolated from their families in a bubble for 3 months. So without that great level of precaution, it is slightly inevitable.
All right, Dr. Neeta Ogden, as always, we appreciate it. Thank you very much.
Thanks for having me.